When an individual and their family, another support team, have a new diagnosis of cancer, it generates a lot of anxiety. And our goal is to get these men and women into the cancer center quickly, to develop a multidisciplinary team, but also to try to allay their fears and anxieties as much as possible. And our staff, frankly, here is outstanding at that. I had a gentleman recently tell me the people here were put here by God. Our staff, from the front desk staff to the nursing staff to all the other support personnel, go above and beyond to make a patient feel as close to family as possible, as comfortable as possible. And we hear that from the patients, and that's an important part, as well as getting the patients in and doing all the right technical procedures and tests and biopsies to having a successful cancer treatment. And the goal of the program here really is bringing Boston to Brockton. We are all affiliated on the faculty of the Beth Israel Deaconess Medical Center. And so the idea is, instead of having a patient who oftentimes is fatigued, sick, nauseated, at infectious risks because of chemotherapy or other treatments, the goal is to avoid having them to go into Boston for treatments that can as effectively be done in a center like the Greene Cancer Center with the Harvard-associated staff that we have here. At least 90 to 95% of all cancer treatments can be effectively administered here. Cancer is a very difficult disease. It's devastating. It turns one's life upside down, and it's critical to have a center like the Greene Cancer Center that provides top-tier, Harvard-level efficient care, but also that provides it in a personal and compassionate way. And our staff at all levels is dedicated to doing that.
We have a beautiful facility here with state-of-the-art equipment, with a superb staff who really tries to treat patients like their own family members. And we are so lucky to have this set up in this community with a connection to an academic facility. The advantage to all of us, patients and myself included, is that we can provide for the patients the best of both worlds, where there is access to care here close to home, access to any specialty care that you would get in Boston. Within the Signature healthcare system, we communicate with one another, so the primary care doctors and any other provider will know what's going to happen and what to expect. If that patient, for example, needs both chemotherapy and radiation, the additional benefit is that now, rather than the patient having to go from one building, get in their car, drive to another site, those things can all be coordinated under one roof. The process of going through treatment for cancer is very daunting, very complicated, and I appreciate that there are many things that happen well outside of the doors of the room of my visit. I think one thing that is absolutely worth highlighting here is that we're a team of many people to work with patients through all the stages of the cancer, not just the technical medical end of things, but the emotional support, the financial concerns, the nutritional difficulties. And we have a superb staff here to help with all of that.